Hey everybody, how's it going? Today we're going to talk about molecular imaging, and this is brought to you by Tim, Carm, Ablas, and Zhang. And right here is a molecular imaging image formed by a PET scan, and this is examining Alzheimer's disease. So what is molecular imaging? Molecular imaging is a form of medical imaging that forms pictures of biological processes. And these biological processes are visualized inside the body at the molecular and cellular level. Molecular imaging also enables physicians to visualize cellular function without invasive procedures such as biopsies and surgeries. So with the occurrence of disease, these diseases often cause biochemical changes, and these biochemical changes can be measured via molecular imaging. Molecular imaging also differs from typical medical imaging from the use of biomarkers, which are also referred to as imaging agents or probes. And biomarkers interact with cells through chemical processes and produce changes on the image through the alteration of molecular processes. So how does molecular imaging work? Well, when these diseases occur, the biochemical activity and structures of cells change, and molecular imaging can detect these changes at the early stages of disease. Biomarkers or imaging agents can detect cellular activities such as glucose, metabolism, and oxygen use, as well as other changes such as vasculature and blood flow. In comparison, standard medical imaging might use changes in density, for example, to differentiate between structure. In molecular imaging, imaging agents accumulate in the body and attach to specific cells before being detected and measured. Molecular imaging is also often carried out via modalities such as PET, or positron emission tomography, and SPECT, or single positron emission computed tomography, which are modalities of nuclear medicine. So an example of molecular imaging is the use of PET, or nuclear medicine, with the use of radiopharmaceuticals, which are radioactive substances that attach to cells and are detected by an imaging device. A radioactive isotope is injected into the area of interest to produce radiation that is detected and then used to produce an image. On a molecular imaging application is where the FDG molecule, or fluorodeoxyglucose, is injected into the body to target cells of high metabolic activity. So the PET scanner can be used to measure the distribution and metabolism of glucose throughout the body, measured by the FDG molecule. So to sum it all up, essentially what happens is a radio tracer is injected to the patient. The radiation source, it travels throughout the body and goes to a region of interest, such as the brain, for example, and is emitted to the detector to produce an image. It is very similar to conventional medical imaging, such as X-ray, where the only difference is that the radiation source is produced outside the body. So this is just an example of a SPECT machine produced by Siemens. So molecular imaging can also be used in modalities such as MRI, and involves the use of MRI contrast agents as biomarkers. Pathological biomarkers are detected for early diagnosis of disease using the high spatial resolution of MRI. There are also many other modalities involved in molecular imaging, such as ultrasound and optical imaging, which uses light. Molecular imaging is not exclusive to nuclear medicine. And as you can see in this image, the MRI contrast agent greatly increases the amount of information you get. So this is an example of an FDG PET scan measuring the glucose levels of a healthy brain versus a diseased dementia brain. And this is an example of a PET scan highlighting the loss of dopamine in Parkinson's disease. And as you can see, a different radio tracer was used to measure the dopamine levels, which is a neurotransmitter of the brain.
So next we're going to talk about how digital imaging and information is used by these technologies and within these technologies. Molecular imaging uses a variety of modalities in digital imaging, such as digital PET scans, ultrasounds, and MRIs. PACS is also an important part of how digital imaging and information is used within these technology, because PACS provides storage and access to images produced by multiple modalities in a convenient way. This is important for storage of information produced via molecular imaging and for any kind of imaging modality.
Digital imaging techniques are essential for molecular imaging. Development of image reconstruction algorithms are also an important part of molecular imaging. A 1D projection in a PET scan or an MRI scan are then used to create 2D and 3D image sets. Image reconstruction is used to produce a viewable image in different planes for these modalities, which is very useful when you're examining an image. A few advancements in these technologies include PMTs and CCDs, which are photomultiplier tubes and charge-coupled devices. And so basically in these technologies, the light is converted into digital signals. These technologies help create better digital images for molecular imaging, and digital technology allows basically for a more efficient and better overall patient care. So next we're going to be talking about the history of these technologies relative to practice trends. Medical imaging began in 1895 when Röntgen discovered the X-rays. Following this, many imaging technologies were developed, including ultrasound in the 1960s, mammography and CT in the 1970s, and MRI in the 1980s. Although medical imaging has been around for a while, molecular imaging is rather new and originated from the field of nuclear medicine with the introduction of the positron emission tomography, or PET, in the 1980s. PET is the most common molecular imaging technology. The concept of PET was first introduced in the 1950s, which led to further development of machines at the University of Pennsylvania and Washington University School of Medicine in the 1970s. There were significant advances in molecular imaging in the mid-1990s due to advances in cell biology techniques. Optical imaging, which originated in the late 1970s, is increasingly growing faster in molecular imaging. Optical imaging detects the light reflected from fluorescent biomarkers in the body. Activity of neurons can be measured from light scattering properties, and this does not at all require the use of ionizing radiation. FDG or PET biomarkers, which are widely used in oncology, was first used in 1976 at the University of Pennsylvania. With the development of new drugs and imaging probes, molecular imaging continues to grow today. Some limitations are that probes need to be tested to be considered safe for use on humans. Approval of molecular imaging agents or probes is done by the Food and Drug Administration, or FDA in the US, or Health Canada in Canada.
So let's talk about the benefits of this technology. Molecular imaging, we're going to be focusing on nuclear medicine and MRIs. They can help diagnose many different diseases that can be harmful for a patient. And they can also help detect these diseases in the early stages before the symptoms are even present. Also, they help make accurate assessments for disease progression. So that can help the doctor to choose what's the most beneficial and best treatment for the patient. Also, these technologies, they're most effective treatment for all kinds of cancerous conditions, and they can also help quantify the disease very easily. Let's continue with the benefits of this technology. So for nuclear medicine, we're going to be focusing on PET scans and MRIs. So PET scans can help stop a patient from getting more harmful and more costly surgery. Also, they can help tell the difference between a malignant tumor and a benign tumor. MRI does not involve radiation, as it is a non-invasive procedure. Also, it uses a contrasting agent that is less likely to produce an allergic reaction. You can see a picture of a PET scan on the left and a brain MRI on the right. Okay, let's talk about where and how is this technology used. So this technology can basically be used in any hospital, so like Sunnybrook, St. Joseph's, and other hospitals that you can think of. Also, it can be used in clinics and in medical imaging centers. So molecular imaging procedures, they're non-invasive and they're safe procedures that are used to diagnose entry brain and bone disorders, cancer, gastrointestinal disorders, heart and kidney diseases, and even lung and thyroid disorders. Okay, let's talk about how a PET scan works. So the procedure starts with the intravenous injection of a positron emitting radiotracer such as FDG. So it takes about 30 to 60 minutes to spread out through the whole body. The patient, as you saw earlier, is placed into the PET scanner, and that scanner uses special detectors to create a 3D image of the FDG distribution throughout the body. So once the scans are done, they're examined and studied by a professional, so like a radiologist or like a nuclear medicine physician, and later they'll send those results to the patient's physician. On the right, you can see an image of a CT scan and a PET scan, and you can tell the difference. Okay, first we talked about PET scan. Let's talk about SPECT now, which stands for Single Proton Emission Computed Tomography. That is a device that uses a gamma camera to detect a radio tracer emitting gamma rays in the body, and that's going to create a 3D image of a certain area. This device can be combined with a CT scan for better accuracy.
How does this technology affect quality and efficiency of services? Molecular imaging allows for early detection. This reduces the chance of a late diagnosis where treatment options may be limited. Alongside other imaging modalities, molecular imaging allows us to identify diseases before symptoms and abnormalities occur. It is also able to provide clinically accurate results in detection because it allows for the integration of not only molecular but also physiological information. This information is specific to each patient with the anatomical information obtained by conventional imaging methods such as X-ray, ultrasound, and CT. This specificity in regards to each individual patient's physiological and anatomical information is what contributes to the enhanced accuracy. In addition, molecular imaging allows for proactive treatment rather than reactive treatment, meaning we can detect diseases very early while they are still treatable. This makes a huge difference. For example, detection of stage 1 cancers is associated with a 90% 5-year survival rate. This can be drastically compared to a less than 10% 5-year survival rate for most cancers detected during stage 4. When lesions are detected even earlier, at the pre-malignant stage, treatment is often curative, simply meaning cancer can be cured at that stage.
How does this technology directly and indirectly affect the healthcare system, patient care, and patient outcome? Molecular imaging can help decrease the healthcare costs. It was used in the field of nucleocardiology, where it helped save a lot of money because it showed clinical approaches while offering a good solution for the patient. That was beneficial for the patient because that helped them avoid unnecessary treatments, discomfort, and side effects. Molecular imaging also allows doctors to see early signs of a certain disease that can help them modify the patient's treatment and overall avoid unnecessary treatments.
So next we're going to be talking about the financial costs for implementation of molecular imaging. Molecular imaging includes nuclear medicine and magnetic resonance imaging, or MRI. This means that the cost can vary depending on the type of application selected. SPECT scans can cost a patient about $3,500, and SPECT cameras cost around $400,000 to $600,000. A PET scanner costs around $2 million. MRI produces a black and white image of bones and organs using magnets and radio waves, which have an average cost of around $2,600. But depending on the location, this price can range from $475 to $13,000. New MRI machines can have a lower cost of $150,000, ranging up to $1.2 million. Safety and other features can be added, which can increase the overall cost by more than hundreds of thousands of dollars.
Will the technology fit easily within an already existing imaging infrastructure? Yes, molecular imaging is already used alongside existing imaging modalities such as PET and MRI. Existing technologies are being optimized for molecular imaging with the development of new probes. New probes are used to identify diseases such as Alzheimer's that are often difficult to diagnose. While molecular imaging is already in use alongside existing imaging modalities, there are some major improvements that can be made to better this technology. Currently, the imaging agents in use lack the appropriate affinity for their molecular targets, which in turn provides us with images with inferior quality. To add on to this, it is very costly at this point of time to create imaging agents. It costs around $50 to $100 million annually, and the reimbursement level, when compared to therapeutic drugs, is significantly lower. To overcome these challenges, scientists need to create newly improved imaging agents. Opportunities currently exist for the development of fluorescence-based imaging agents, one of the most important growth areas in molecular imaging. Fluorochromes, which are chemicals that fluoresce, are inexpensive, stable, and involve no radiation and have been used safely for the past 20 years. If scientists were to better incorporate and advance more of this specific technology, we can be optimistic that molecular imaging will contribute in many more important ways to the overall care of patients.